This is a recording of Let's Talk About Alternative Methodologies. Discussion number 1, Embracing Alternative Methods for Setting Subsidy Rates.
And now I'd like to turn it over to the Office of Child Care to start us off.
Thank you, Heather. Good afternoon, everyone. My name is Anne-Marie Toohey, and I'm the Deputy Director here at the Office of Child Care. And I have the easy and wonderful job of welcoming all of you and thanking you for being here with us this afternoon and taking steps to learn about alternative methodologies and how we might increase provider payment rates. If you were able to attend one of our recent regional cluster meetings, you heard OCC Director Ruth Friedman talk about how we're prioritizing equal access to advance equity for children and families served with federal child care subsidies, and that we share a goal with lead agencies of working to ensure that all families have access to high-quality child care. We are committed to supporting using cost-based alternative methodologies to inform payment rate settings and increase rates closer to the cost of care rather than using a price-based market rate survey. As you're aware, higher payment rates improve parents' access to high-quality care that best meets their needs, increases provider stability and quality, and can support increased wages for the child care workforce. We know that lead agencies are thinking about CCDF plan submissions for next July, and OCC doesn't want a compressed timeline to be a barrier to any of you in moving forward to a cost-based approach. Please feel free to reach out to the regional office to discuss timelines or any other questions you may have. OCC central and regional offices have had several informational meetings with lead agencies in the past few months to discuss alternative methodologies and have found them to be very helpful. We appreciate this partnership and getting your feedback and insights. Just wanted to thank you again for taking this time to learn about and discuss alternative methodologies. This is the first in a series of discussions that we hope will help move lead agencies towards alternative methodologies for payment rate setting. Thank you again.
Thank you, Anne-Marie. So we're going to start off with a question for the participants. Our first question is, what are your perceived challenges in conducting an alternative methodology in the chat? I may or may not be able to answer. We're not going to necessarily be able to answer all of your challenges or questions, but we want to start hearing from you what those challenges are, and it'll help us start thinking about the resources and future topics for these sessions. And as you think about those challenges, you will have the opportunity when we move to small groups to share those challenges again and really have some conversations with other lead agencies, states and territories and tribes around what those ideas, solutions, brainstorming. So go ahead and continue. I don't want to rush anybody into putting things into the chat, but we're going to actually move forward. But please go ahead and put information in the chat as you think of them. So we wanted to start with why we use cost data to set rates and why it matters. And we also want to cover some terminology basics to ensure we have a shared understanding of terms we'll use during this series. Feel free to share questions in the chat or raise your hand at any time. As I said before, we may not be able to answer all questions today, but we are collecting questions to answer in future sessions. So this slide illustrates a few of the reasons that cost data is important. However, it is not an exclusive list, and there are many other reasons as well. Price does not always reflect the cost of providing childcare. Prices reflect what parents in that area or using that program can afford. Childcare providers must set their prices based on what parents can afford and not what it costs to provide care. Because prices reflect what parents can afford, programs that serve families that cannot afford high rates need to subsidize those families. Often they subsidize through low wages, less materials, and space challenges. Cost data can help us understand what is needed to support higher wages and compensation packages in childcare programs. And it can help us understand what is needed to provide the basic level of health, safety, and staffing needed to support all children, including those with specialized needs. It can help us understand what is needed financially for a program to move up in quality levels. And it is possible that childcare providers, when compensated adequately, do not need to make large financial sacrifices to operate. They may expand to serve more children, be open to serving children with specialized needs, and more people might be willing to open a program, which will potentially increase the supply of childcare and the supply of high quality childcare that's available to our most vulnerable families. So we did want to talk a little bit about terms, just so that we are all on the same page around these two terms that we use a lot, and those are price and cost. If you ask a provider what it costs to provide childcare, they'll often tell you what their rate is, which is not necessarily, and in most instances, never the cost of providing care. It's simply what they charge families. Price is what childcare providers charge families for care, while cost is what it costs them to provide the care. It's important to remember cost is often much more than the money spent by the program to operate, or what we know as the program's budget. Cost includes non-monetary items such as donations of materials, space, use of volunteers, and more. It also includes aspects that can be harder to capture, such as a program that doesn't make needed repairs or is unable to provide the necessary supports to children with high needs. Regardless of the difficulty of capturing costs, it's important to try to capture them to understand what is needed to provide safe and healthy care to children. And since we are talking specifically about alternative methodologies, we did want to do a reminder about what an alternative methodology is. Sometimes we use these terms, throw them around, and just assume we all have the same understanding. So we wanted to make sure we didn't do that today. So an alternative methodology is simply a different way to set subsidy payment rates other than a market rate survey. It can be a cost model, a cost study, or a hybrid, or another method. And we're going to talk a little bit about those different options in the next slide. It also must be pre-approved by the Office of Child Care and must be statistically valid and reliable. And we do have a link. If you search for the guidance, there is guidance on alternative methodologies from the Office of Child Care. So as I promised, we're going to talk a little bit about the options, the approaches for a cost-based alternative methodology. The first option we have listed is a cost survey. This is a study typically based on a sample of providers in a given state or territory. You might use this approach if you want information from your provider community about their actual costs. This approach requires significant resources to ensure that providers are clear on the data to provide and is collected in a manner that is usable to the lead agency. Cost surveys use a survey tool to collect the information for analysis. They can be limited or they could be very extensive, based on your needs. A cost estimation model is an approach where you estimate the cost of providing care at various levels of quality. You may take this approach to take the next step to really understanding the costs of childcare at the different levels of quality, different ages, and capturing information in a way that is you can manipulate and understand impacts of different policy changes. If you want to use cost information to analyze other impacts, you can do that with a model. And then there's the hybrid approach. And the hybrid approach is using the cost model and the cost survey together. The cost survey often informs specific data points in the cost model. The states that have used a cost-based alternative methodology to this point have been using a hybrid approach to building their cost model. So we're going to pause and see if there are any questions before we hear from Virginia and New Mexico about their experiences using alternative methodology. Well, again, not to rush anybody, but I will come back to questions. So if you think of something, feel free to put it in the chat. But we are going to move on, and we're going to hear from Virginia and their experience with alternative methodology.
Thank you, Heather. Can you hear me okay?
We can, yes. Thanks, Alex.
Great. There is a lawnmower that keeps going past my window. So I hope that I put in my headphones, so hopefully you can't hear that. But if you can, my apologies. So would love to share a little bit about the approach that Virginia has taken to our alternative methodology in the Child Care Subsidy Program. And again, my name is Alex McPherson. I am the Associate Director of Enrollment in our Division of Early Childhood Care and Education at the Virginia Department of Education. And excited to chat with you a little bit more today. Before we dive into specifics, I think it's important to share a little bit of context about Virginia and some of our partnerships. So our state partners with researchers at the University of Virginia to evaluate the impacts of policy changes on families and providers. And so together we've collected data on thousands of programs, educators, and administrators across the state, and we utilize those data to help drive decision-making in all that we do. So the data showed connections between what Virginia pays providers and what providers pay their teachers. And very similar to some of the things that Heather just raised a little bit ago. And what we found in Virginia's data is that teachers and centers participating in our child care subsidy program earned on average about $2 less an hour than their counterparts in unsubsidized centers. And those gaps are even larger for assistant teachers. We also found that subsidized centers had more teacher vacancies, more turnover, and just a harder time in general recruiting staff. And so those data show us that our public payment rates have a direct impact on a program's ability to recruit and retain qualified staff, and provided even more urgency for us to act in a data-driven way when it comes to the payment rates in the subsidy program. So we worked with Simon Workman at P5 Fiscal Strategies to derive a Virginia-specific model based on the provider cost of quality calculator and created 5 different scenarios. For center-based programs, there was a scenario for a large, a medium, and small centers. And those scenarios did not differentiate between licensed versus regulated centers, as Virginia's licensing and subsidy requirements for centers are very similar. So those were the center-based scenarios, just depending upon size, large, medium, and small. And then for family child care, what we call family day homes in Virginia, there was a scenario for large licensed homes and then another for small unlicensed homes. And that reflected more significant differences in health and safety requirements due to the differences in our subsidy requirements versus licensing in those program types. Heather, should I pause there and see if there are any initial questions, or just kind of like roll through some more talking points?
Feel free to keep going, and if people have questions, go ahead and put them in the chat, and I'll pause you, Alex, if we get a question. How's that?
Sure, thanks. Yeah, I've got a little eye on the chat as well, so that's perfect. So I thought it might be helpful to share some of the program assumptions that we made in our alternative methodology cost estimation model. And so there were a few core assumptions in the model. The first is that the model assumes programs are meeting minimum health and safety requirements either associated with the requirements of licensing or with participation in subsidy. And so that, of course, would include age-appropriate group sizes and teacher-child ratios. The second is that the model accounts for regional variations across the state in terms of wages and other operating costs. So our state is broken up into 9 ready regions, and so the model set 9 different rates, one for each region. Third, the model assumes that programs maintain at least 85% enrollment efficiency relative to capacity. And lastly, and this one is probably the most nuanced assumption here, is we assume that the costs associated with quality are 2 things. The first is competitive compensation for staff, and the second is support for educators. So that would include benefits and paid time off for staff. So Virginia has a quality measurement improvement system called VQB5, and VQB5 focuses on 2 factors that research show are most directly connected with child outcomes, and those are the use of a developmentally appropriate curriculum and teacher-child interactions in the classroom. And those teacher-child interactions are measured using the class tool. And what we found is the main driver of quality based on those measures is ultimately the educators in the classroom. And so we believe that the extent to which programs can recruit and retain qualified, well-prepared teachers is really important and really goes hand in glove with quality. And we know that competitive compensation, including benefits, paid planning time, and ultimately, teacher pay, is a huge driver in recruiting and retaining staff. And so that's where our model really focused in terms of defining quality. I'll pause and see if folks have any questions. Nothing in the chat so far. Okay. And so as Heather shared earlier, competitive compensation is so critical. And so that's something you'll hear us talk about a lot in Virginia. And that was really the real difference maker in our methodology. And so, of course, there's no one size fits all to how a state may define competitive compensation. It can be defined in so many ways. In Virginia, we define this as wages. And so we pegged the wages in our early childhood model to the K-12 teacher salaries. And so we did do some adjustments to account for differences in teacher preparation requirements, but we used statewide elementary school teacher salary data to get an average hourly wage at a regional level, and then just prorated that down slightly to estimate wages for lead teachers and for family day home operators. And those lead teacher wages served as the anchor, and then other staff positions were adjusted from there, kind of around the lead teacher wage. And so after all of that was built out into the model, we were ultimately able to set rates. So we received the kind of outputs from the model, and then we adjusted those slightly to set our rates. So people often ask, what percentage of the cost of care do we set rates? And so all of this has been new for us. The rates that are based on the cost estimation model just took effect in Virginia in the fall of 2022. And so at that time, we increased payment rates for all providers in the subsidy program. And in most cases, the increases were sizable, especially for our youngest age of children served. So infant and toddler rates increased pretty dramatically. But center-based full-day rates were based on 75% of the modeled cost. And then in family day homes, full-day rates were set at kind of like a tiered percentage depending on the age of the child. So 94% for infants, 82% for toddlers, 76% for preschoolers, and 70% for school agers. And the reason for that is because the model doesn't distinguish between costs for kids of different ages in a family day home, because it assumes a mixed age group setting. And so when we initially, in our stakeholder engagement last summer, we proposed setting a single rate for all age groups in family child care, and the feedback we received from the field and from family child care providers is that that just wasn't a nuanced enough way to set rates, that they weren't particularly comfortable with having a single rate for all age groups, and that it was important to see some difference across the ages, and for example, for infants to be a higher rate just given the ratio and the cost associated with serving infants. So that's why we took that kind of graduated approach to how we set rates in family day homes. I am excited to share that we are increasing rates for family day homes again this summer. So effective in August, family day home rates are going to go up to 100% of model cost for all age groups. I see something in the chat. If applicable, what data did you use to inform facility occupancy, such as rent or mortgage? And did you look at this regionally? I would have to go back and look at the specifics about rent and mortgage, Amy, but yes, my basic understanding as far as the regional piece goes is certainly the wages were set regionally, and other kind of cost of living and cost cost of living across the state was factored into the 9 different regions. I'm sure this is the case in many states, but in Virginia we have a real range, all the way from Northern Virginia close to DC, where cost of living is extremely high, and Southwest Virginia and Appalachia, where cost of living is not nearly as high. And so Simon and P5 fiscal strategies pulled in some of those different cost of living calculators to help account for some of the variations regionally in our states. But I can drill down to see about like rent and mortgages specifically, because I'm just not sure. But I would assume that's factored into the cost of living calculators. Great question. So, just to kind of tie this back again to quality one more time, and then, I want to make sure I leave plenty of time for Secretary Grudinsky to share about the great work in New Mexico. But we have also changed our approach to how quality factors into the payment rates and when providers experience the rate based on quality. And so what I mean by that is we set rates using the model outputs, and that included competitive compensation and included all the supports for providers to meet quality expectations in VQB5 on the front end. So rather than saying to providers, once you achieve a certain level of quality, then you will receive this rate, or setting like tiered rates based on quality, we've moved away from that. And what we said is, this is the amount of reimbursement rate that we believe is needed in order to achieve the quality expectations in VQB5. Therefore, any program that is participating in the subsidy program will be reimbursed at those rates already. And then the hope is providers will be able to use that increased funding to meet the quality expectations and have everything they need on the front end to be set up for success, and to support their staff and compensate them competitively kind of right out of the gate. And I think it's also worth noting that these rates are being paid to providers regardless of what they charge private pay families, and that is a bit of a change here in Virginia. We really want to make sure that there's equal access and opportunity for all children and families in the state, and so we didn't want to have an adverse impact of providers increasing what they charge private pay families in order to access a new higher reimbursement rate from the state. So providers may receive the state's rate, even if it is something greater than what they're charging their private pay families, or if they do like a sliding scale. We do have the option for providers to opt out of the higher rate if they would so choose. So far, no providers have taken us up on that option though. So I will pause there and see if there's anything else I can share, any questions. What were the net differences after implementation? Did most providers see an overall increase? Yes. So in infants and toddlers, in family day homes, it was 100% of providers that saw, or 100% of localities, I should say, that saw an increase. In centers, it was like 99% of localities, every locality but one. And then as the age groups went up, what you found is there wasn't as big of a gap in some localities between what the market rate survey was showing that providers were charging and what the cost estimation model showed that the providers should charge. And that kind of ties back to what Heather was sharing earlier, and just the flawed approach to setting rates and the broken market really in childcare, and the fact that infants are so expensive to serve that most providers don't charge anywhere close to what it actually costs to serve an infant, because it would just be astronomically expensive and few families will be able to afford that, right? So what a lot of centers will do is they'll kind of almost take a loss on their infant rates, but then make up for it with their older age children that they're serving, where they can have more kids in a classroom and that kind of thing. So anyway, what we found is, I want to say about 2/3 or maybe 70% of localities in our centers in Virginia experience an increase, which is still the vast majority for school agers, but we saw the biggest increases for infants and toddlers. I feel like this is a multi-part question. Also, feel free to come off mute and talk. You can talk. I don't know if that works, but let me read what else it says here. Was there a reduction in the number of children served? No. So a couple other things here. So we had those increases, and nobody experienced a decrease, I wanted to add. So in any scenario where a locality was already receiving a rate that was equal to or greater than what the cost model projected, we held those rates harmless. So in those couple of places, their rate just stayed the same. And then as far as the number of children served with subsidy, so we have a legislative mandate right now in Virginia to not have any wait lists, which means that we are continuing to serve children as they come to us in the program, and the program has continued to grow and grow and grow. And we are using those data to try to make a case for a state investment in the program. Hopefully, we will be successful in that, because as you're probably imagining, we are spending lots more money. Does that answer the question, Allison? Great.
It does. Thank you.
Yeah, absolutely. Yeah, it's giving us all a little bit of anxiety, as you can imagine.
Yeah.
But, it's interesting because there's been a narrative for a long time that around parental need and demand for services. And when we had wait lists, it kind of suppressed the ability to demonstrate demand, because the number of children enrolled never grew, right? Because there was just a wait list. And so by eliminating wait lists, because we were directed to, what we found is, well, would you look at that? The program has grown every single month. And each month we have continued to serve more children than ever before. Every month is a historic high. So not only has the program rebounded from COVID, it has significantly grown to serve even more children and families than the state was serving prior to the pandemic. And so it really has enabled us all to demonstrate and to see how much parental demand there really is, and that the need is quite great.
That's super helpful. Thank you.
That's great. Thank you, Alex. I think we're actually out of time because we don't have that much time, and we want to also hear from New Mexico. So I want to thank you very much for sharing your experience, and encourage you to stay and participate as well.
Yeah, thank you for the opportunity, and happy to answer questions if folks want to send an email.
Great. Thanks, Alex. And so I am going to move it over to New Mexico.
Thank you, Heather, and thank you, Alex, for a great job on giving the nuts and bolts of cost estimation modeling. I won't go into the similar things because I think she did a great job covering that, but I want to highlight 3 things that I think really separate the cost modeling work from what a market rate would give you. One is strong partner engagement. You start from the beginning, and we did the hybrid, so getting that cost study, talking with providers. Similarly, in New Mexico, family childcare, we call it group home, which is our 12 children in a home, and center-based care of all levels. We have a 5-star quality rating system called Focus, And so along all of that continuum and that wonderful milieu of providers, Spanish speaking, folks that are serving families in very rural parts of the state and urban parts of the state, we met regularly. And you have to if you're doing the cost model, and you have to check what you're doing and check your assumptions. So it feeds a lot of it feeds many birds with one seed by going through this process, because you're in it together and it's a community that's learning together. I can't emphasize enough how important it is to keep that learning going, and we're starting that up and have been doing it because it's a very different way of approaching how we think about equal access and how we think about subsidy rate setting. The second, it gives you an opportunity as the lead agency and with all your many partners to do a thorough analysis of your early care and education system, from your licensing to your professional development requirements to your quality rating and improvement system. Are all of those things connected? Are they interlinked? Do they have different drivers of cost? And so you get a chance to sit and really analyze that because you have to determine what costs you are driving by the regulations, by the laws, and by the requirements that you're putting in place. And third, and probably most importantly, it provides amazing clarity for policymakers. When you finalize your report and you're able to really demonstrate to them what's driving the cost. What is it about group size and ratio that makes infant toddler care so expensive? And we had, the first time I presented the results, we said we modeled on a 12.10 minimum wage, even though the state at that point was at about a 10.10 minimum wage. There was a move. The governor had passed a law where it was going to become $12 an hour. And at the time we were doing the study and the modeling, the highest minimum wage in the state was $12.10. So that was a choice point we made. We shared this in August of 21. I'm thinking it was 21. And that's when everybody, was paying $17, $18 an hour to do almost any job in retail or anywhere. And so the legislators saw clearly, like, well, how are we going to get people to work in this industry if we're only paying them $12.10 minimum? So it provides the information and the data points that we need, but done in a model. So if you decide to make a change, say in your group size or ratio for different age groups, or in what you believe your minimum salary or hourly rate should be for entry-level people coming in to childcare, or higher quality teachers teaching in those classrooms, it allows you that flexibility. And so it's a dynamic process, having the model and the study. So those are three key things that I think are the reasons that we should all get excited about cost estimation modeling, because it will drive the change that we all want to see and we know needs to happen, and that is increasing the compensation of our early childhood professionals. So the other thing I would highlight, we did not have any regional variation. So different from Alex and what they saw in Virginia, we also worked with prenatal to 5 fiscal strategies, and Gina Capito and Simon Workman and their team, and Jessica, they're doing interviews, surveys, and really across the board, we did not see much variation in terms of what people were paying people working in childcare, what people needed to be paid working in childcare, regardless of where they lived in the state. And we're pretty big. We're the 5th largest geography, but highly rural, and also a few urban pockets. The question on the rent and the mortgage, there is a set process where you look at data in the state, but you're checking those assumptions. That's that stakeholder engagement, that provider partner engagement all along the way. You're coming back to that group and you're saying, this is what we found. This is what we found from interviewing you, from doing surveys and focus groups. Does this check with what your reality is? Sometimes it does, sometimes it doesn't. We have discussion. Similarly, on the quality rating and improvement, some of it's in licensing, so it's not negotiable. It's the ratio, it's the group size. You have to have this many teachers. This, different licensing regulations allow for different flexibility. Do you always have to have 2 teachers in the room, or is it just the ratio that you're concerned about, or the group size? So I think it's exciting because you become incredibly in depth and familiar with your system. And you're able to communicate that system to a variety of stakeholders who also need to better understand the business model and also the financing required to make it high quality. Some of the things that we also found were the state had just passed a law that required all small businesses to give their employees, I think it was 60 hours of paid sick leave. Well, we needed to model that. We needed to put that in there because most of these are small businesses. And so what that does in your model is it's going to mean you need more either more substitutes or more floaters, more time out of the classroom for that educator and for that educator assistant to be able to take their sick leave. We also modeled in 2 weeks of paid vacation because we think that's important for people working with young children who also have children of their own, and they also would need that. So we did that in terms of modeling the additional staff that would be needed. And we added in our first round, and we increased it in the second round that's out for proposed rulemaking. But we started with $5,000 per employee as what we call benefit. That could be in terms of healthcare, it could be in terms of retirement. We know it's not really enough to cover what is the true cost of that care, but we knew that it was important for our rates to say this is what's important to delivering really care at any level, and high quality care, absolutely, to attract and be competitive in the field. So those were some of the things, overall, what you'll see and why we know why compensation is so low is because your personnel are your biggest cost drivers. It's anywhere between 75 to 80% of what is in your rate. And so I think we see, when we know families can't afford to, bear that full cost burden, and yet we know what young children need. So for us in New Mexico, our ratios and group size are not where I would ideally like them to be. At the 2 and 3 and 4 star, it gets a little better. But you can see, how that changes the cost per child when you can have more children in a classroom with 2 teachers versus less. And again, those revenue streams. So we also included the Child and Adult Care Food Program as an important part of a revenue stream that programs we want them to take advantage of. We don't require it, but it's something that we see as very important. And then, of course, the tuition, we, similar to Virginia, don't require them to charge private pay families the same as the state pays them. And then, of course, New Mexico expanded eligibility to 400% federal poverty level. So more families have access to the rate, which has helped providers expand their capacity and to be able to serve more children and fully staff up their classrooms. So overall, our rates went up for infants in centers, went up 22%. But for an infant in a family child care home, it went up 54%. And I'll tell you, the biggest driver of that was we were doing the modeling for family child care, and we said, well, wait a minute, here we're putting in salary for teacher, director, all in the center. But we need a salary for a family child care provider, because what we've traditionally seen in our field is that it's revenues in, everything gets expensed out, and whatever's left is what the family child care provider has for their quote salary. So we use the lead teacher as the salary that, that has got to be a cost. And so we have to pay for that. So after all the expenses are done, that there is a salary for that family child care provider at the end of the year. Good discussion among the provider community. Should that really have been sent at the director level? They're really doing all these different jobs. It's a good conversation for us to have and for us to keep thinking about as we continue to use the modeling to set rates in our next 3-year plan. Toddler rates in family child care went up 83%. So you can see how low these rates were, 70% for preschool. In center-based, our preschool rate went up about 17% and our toddler about 8%. School age didn't really move much in either setting, and those rates look good. So again, we were able to see from what our data was showing us that those rates were good. We were able to meet 92% of the cost of care in centers based and 100% in family child care. The bulk of our children is probably in your state too, maybe not, are served in center-based care. So you're always, once you finish your modeling, you're saying, okay, this is the model. This is the model's telling us based on these assumptions that we built into it, which Alex described very well. And then you say, okay, what revenues do I have? What do I have available to me? what are my other choice points? So you don't think of the model as like where your rates are. It's a next process. You do the modeling and then you say, okay, how close can we get to the cost of care? You may not get there at, we got to 92 and 100 for family childcare, but that may not be what your state's able to do, but you're at least wide-eyed, what you're looking at, how much revenue your providers are losing in actually delivering the care. And so then you can maybe do things like think about shared services or find other strategies. It's not only the subsidy rate. That's the other thing I love about cost model is that you can really begin to understand the system and think about other policy solutions in addition to rate setting that could help improve the quality of care and compensation, most importantly for early childhood professionals. I think that's all I have. Heather, if anybody has questions.
Feel free to unmute yourself if you have a question, or you can feel free to put it in the chat as well. We do have a couple more minutes if we have any questions.
I can just add one thing, Heather, since I still have a couple minutes, but I think that what we've been working with, not only the provider community, but the advocacy community around the compensation is, again, that 1210. And then, we saw what happened across, all categories of industry and what people were paying. And so, our proposed rulemaking now has set that, at 15 instead of 1210, with teachers at 20 and directors, at a much higher level. And then of course, much higher levels at the higher levels of quality. But that's what a model allows you to do. And I think Alex talked about that a little bit. Like what do we need to have in our rate setting to have competitive wages and to attract and retain the talent that we know young children need and that families need and are expecting. And that I think is a good dynamic, because then you're having a good values conversation and you're having it with providers. And I think where we want to move is that there's enough money in the system to provide the quality care. Now we're going in to provide good technical assist. I mean, we've been doing that, but we can get more serious about the expectations around technical assistance and professional development when the resources, they're actually resourced to deliver that. And I liked hearing how Alex was saying similarly, like, we can hold it back and say, hey, can you get here? And then we'll give you this. But we know that the field needs the resources. We've been woefully underfunded for so long, and it has been really on the backs of the professionals who are serving our babies and toddlers, preschoolers. So I just emphasize that that's another exciting dynamic of the cost alternative methodology that allows you to be forward thinking. Where do we want to go? What would that cost us? Engage advocacy, engage providers, engage policymakers in the whole process.
And I know that you also have engagement with your tribes as well. Can you speak a little bit about that? I know that can be a unique challenge.
Yes, we have 23 tribes, pueblos, and nations, and I forget, maybe 8 or 16 of them are their own CCDF grantees as well, and we've shared with them the work we're doing here. And I know our 8 northern Indian pueblos have engaged also to look at using cost alternative methodology in setting their rates, and just becoming very interested and intrigued by a different way of thinking about how we're building our system. This has really become a part of it. So we meet quarterly with all of our tribal CCDF grantees and have good discussions about this. But yeah, we were excited to see that at least, well, they kind of represent a number of pueblos, the small pueblos, the 8 northern office. So more to come on that, but it has been a very strong partnership we've been building over the last couple of years.
Great. Yeah, we'll definitely be looking forward to hearing more for sure. And so without seeing any questions or hands, I am going to actually thank you, Secretary Gerginski, for sharing New Mexico's story and your success in using cost-based alternative methodology. And as with Alex, feel free. I know you're both very busy, but feel free to stay, and you'll be in one of the groups if you stay to share with lead agencies. And we are actually going to transition now to the small groups. So this opportunity for everyone to talk to each others in other lead agencies. We have mixed people up, so from different states. Hopefully it stayed that way. So we're going to open the breakout rooms, and you'll be prompted to join your group. If you, for some reason, didn't end up in a group, Teresa, Heidi, and Beth are here in the main room and will help you get into a group. So no worries there. And each group has a co-facilitators that will prompt you with some questions, but is really about having the discussion with each other. And let your facilitator know if you're having trouble, or you can leave the group and come back to the main session, and your Teresa, Heidi, or Beth will be able to help you. So I am going to go ahead and open those rooms right now, and it may take a minute for us all to transit. So thank you everyone for participating in the conversations. We're going to take a moment to share the highlights of each of the conversations with the entire group. And I'm going to call on each of the co-facilitator groups to share, and participants feel free to share any thoughts in the chat. Or again, any questions that came up or are coming up for you now. So I am the first group, and I am going to see if Laura, if you'd be willing to share some of the highlights.
Absolutely. And then you can tag team with me. So I think the big highlights were, especially when you're dealing with big geographic areas, there's just a lack of sufficient investment to get you where you want to be and where you think you need to go. And so there was certainly a lot of talk about the state investment was just enough to meet federal match. And that just wasn't getting people to where they needed to get to move the bar. Another thing I'll say that seemed to kind of lurk in the shadows was this, we need help. We don't have big staffs, so we need to rely on the federal TA system to support the work, and so making sure that people have access to that as well. So yeah, it was really the lack of fiscal investment to move the needle, regardless of your methodology chosen and what you choose to find. You're kind of afraid to find out the answers when you know you don't have the resources to make the next step. So we did talk a little bit about going through the methodology to maybe highlight a special population or a disadvantaged population that you want to elevate. So you wouldn't be raising the bar for the whole, but you would use a subpopulation. So what else did I miss?
That was a lot of our conversation, really was around the challenges, the political will, and how to think about how could we address getting state support to have additional funding. And the balance between how many children you have on the program and the cost associated with raising rates, and that impact that could have if you don't add additional funding. And so I am going to move to the group that was facilitated by Elisa and Patty.
Hi, this is Patty. The primary themes from our conversation, our group was really in a learning space. So they really wanted to know more and learn more. And similarly, Heather, to what you just said, certainly identified that political context in the state or territory plays a large part in the ability to make progress on this front. Our key takeaways were really the identified barrier of providers not understanding about their business operations and including understanding what their actual costs are. So really having to do some coaching and mentoring to help them get there to help you all achieve your goals. And then a key question was somebody in our group was interested in any data models that might include an opportunity to weight the data based on the size of the program, the number of children, etc.
Great. Thank you. I think I'm going to move to the group with Nancy and Lisa.
We had some good conversation. It sounds like there might be a common theme happening. I love Laura's fiscal investment that seemed to come up as far as, there's some research being done, and the states in our group were in the planning stages thinking about it and had already had some research done and are already realizing that they already know the answer, that that's going to be an expensive endeavor and how that's going to happen, and then maintaining that once they get there. So that was a big one. Messaging, and then there was a conversation about waiting list and, the waiting list in terms of raising the rates and that kind of thing. And the questions came up about how do you balance it, how to manage the wait list and that kind of thing. And I think those were the main ones. Did I miss anything, group?
No, I don't think so, Nancy. I think, with the waiting list is how to message that, right? And you want to increase rates, but you have a waiting list. And how do you message that and be successful with increasing your rates?
Thank you, Lisa.
Great, thank you. And Jeannie and Nina.
Share a couple takeaways, and then Jeannie and others in the group, feel free to add others. Or expand on these. So one thing we talked about was the value of engagement. And we had people in various stages in our group. So we had someone who had completed an alternative methodology, someone who was in the process of getting approval, others who were interested in doing it. So it was a really great group of people. But we talked about how the importance of ongoing communication with communities about cost modeling and involving providers and communities from the beginning of the process, and the importance that that plays and the value that it contributes to cost modeling. We also had someone raise the question about the value of a market rate survey. So I thought that was an interesting sort of conversation about the role that a market rate survey plays. So if you're still doing a market rate survey, is that helpful? Is it helpful just to focus on cost? And if so, then what would you use to inform revenue? So that was an interesting conversation too. Jeannie, would you add anything?
I don't think so. I think that was it. Thank you.
Heather, could I pose a question to Nina? Because I think it came up in our group. Is there any data that could be provided to states who have been on a journey with alternative methodology and then went back and did a market rate, and what lessons were learned between the two data sets? That came up in our group, and I don't know if there's a study out there about that.
Oh, I feel like they're just so different that that's a great question though. And I don't know if Elizabeth is still on the call, but I thought she has some interesting thoughts about market rate surveys versus alternative methodologies and what New Mexico has decided to do.
Not sure that she is still on the call.
Okay.
So Laura, I do think that Washington, D.C., which has done cost modeling now for a number of years, it's my understanding they were going to do a market rate survey, but only to gather data that then they could use for revenue, and they would base their rates based on cost of care, not based on the market rate survey. They're just using it as a data source. Is that correct, Heather?
Yeah.
Yeah.
Yeah,
Okay.
it was a data source for revenue. Mhm. But we have captured the question, so we can pose that to the states that have explored alternative methodology to get a little bit more robust answer. But, all right, and I believe our 5th group ended up getting shifted around. Was there anything, Anne, Carol, Mary Beth, that you wanted to add? No. Okay. All right, so I am going to try. I'm going to launch a poll for those that are here. Everybody can participate in this poll, and I'm going to launch it right now. It is specifically about future sessions. We want to know what to prioritize for the very next session, next couple of sessions. So what you're going to do is have an opportunity to list your priority 1 through 4 of what you want to explore. Again, I know there's Federal Office of Child Care staff. Feel free to also participate if you're hearing from your lead agencies and where they want to prioritize. And we are going to address all of these topics. It is just helping us prioritize the next session. And also, if you have other topics you would like us to explore, feel free to put those in the chat. And we definitely will look at those, see what we can do for topics. We anticipate this being an ongoing conversation where we'll be able to talk about different topics, and it will be evolving as more topics come up, offering more sessions. I'll just give it another 30 seconds. Right now we have an even tie. So if you haven't prioritized, I mean, there is definitely some priority in there, but definitely go in and vote for me.
Heather, if someone chooses other, should they type in the chat what that other option?
Yes, please. If you do choose other, please put in the chat what topics you would think are a priority.
It does make you choose something for other.
Yeah, okay. All right, so I'm going to go ahead and end the poll. And share. And actually, we do have quite a few people that are interested in other, and it looks like data collection and stakeholder engagement is up there. So data collection is a big first choice, as well as cost modeling for family child care homes. So thank you so much. We are going to take this back. We have a planning group that will share this information with. And so just to close us out, I wanted to go ahead and put the next session on your calendars, though we don't have the topic yet. It is July 19th from 3 to 4:30 Eastern Daylight Time. And so mark that on your calendar so that you can join, and an announcement will be going out soon with what that topic will be. And then we also have some resources. I know it's hard on a meeting and webinar to write down this information. What I will say with this is these are from the Office of Child Care website, the technical assistance website, and at the last resource actually came up in the small group I was in, which is technical assistance is available to all lead agencies You can access that by talking to your state system specialist, or there is also a form that you can get to. So your child care CCDF administrator can request TA, and then we can help support you through these things. And that is the end. So thank you so much, everyone, for joining us. And I appreciate these conversations, and I look forward to the next session. Thank you.
Thank you.
Thank you.